Yeah, so we have been invested in supporting women for the past 2 decades, and currently we have two models for supporting young women uh, who are in extreme poverty in Kibera and other slums. So we have our Funzo project, which is basically a pathway for teenage mothers to realize their rights education, and we pair this with psychosocial and mentorship. And we do this largely through engagement with community members, uh, mostly to drive advocacy, but also to have long-standing engagement beyond just the project period. Secondly, we have our safe space model, which is one of our pioneer projects with Population Council, and it's basically creating safe space within communities for young women and girls, basically, to be able to get mentorship, learn, but also model other young girls within the community. And
Now,
so we've done this for a while, and we are now even spreading it across other communities in informal settlements in Kenya.
Jeff, let's talk about the kind of medical services you're offering those young women at the Tabitha Medical Clinic in Kibera.
Right. So we know that health is key for supporting young women. And so we run 3 health facilities. We run Tabitha Medical Clinic and a maternity home, as well as a youth-friendly center. And within this facility, we offer primary care. We also provide some key services that are not accessible for a lot of young folks, especially young women in Kibera, such as antenatal and postnatal care. We offer family planning. We also offer cervical cancer screening. And we offer quality service that is mostly lacking in informal settlements that we operate in.
Can you give us maybe an example of one of the success stories of girls you've mentored through that program? Girls coming from Kibera, we know it's really an impoverished kind of part of the country in Kenya. Give us something outstanding there.
Right. So through our Funzo project, we had a really encouraging and uplifting story of this young girl called Caroline. We recently recruited her through our Funzo project, and she basically had dropped out of school for over a year. And she was also shunned by her family, and she was, basically out of the family house. And we had the opportunity to support her through the Funzo project. And after being out of school for over a year and just going back to school, almost just 3 months now, she's topping her class. But that's not, it's the idea that there is so much potential that is untapped because there are so many barriers that prevent young women accessing education, which is the cornerstone for development. And so Caroline is currently, she is an example of what education can do.